Hi everyone, welcome back. Today is the first video that I'm gonna speak to you in English because today I'm gonna introduce you my new book. It's English for Nurses. In this book, I hope that it's gonna help you for communicating in English when you work at your hospital, wherever you work, in Bangkok, in Thailand, wherever in Thailand, or when you just work overseas, when you work in the United States of America, Canada, Australia, Singapore, or wherever you work. Okay, so in this book, English for Nurses, is 100 medical English conversation for nurses. It's not only medical English conversation in here. I'll give you a lot more than that. Okay, so it's a bilingual book. It's English and Thai, so you can read in English and you can have the translation in Thai to make you more understand and able to use it in real life. We'll talk about the table of contents. So we'll have 15 or 16, yeah, 16 sections. So the section 1 is the best step of learning English. So you will know that how you could learn English. I give you some steps, the best one for you to learn English. And the section 2 is 12 tenses in English grammar. It's a grammar just for you to review the grammar. And the section 3 is 100 common phrases. It's a short phrases that you can remember, you can use, you can try, and then you can practice. When I started to learn the medical English at the first time of mine, when I started to work in the hospital, I start with the common phrases as well. I try to practice the short phrases, the short sentence first, then I can use it in the real life of working to use it with my patient. And section 4 that I give it to you is medical nursing idioms, so that you can use as some idioms. And section 5 is nurse and doctor conversation. For the nurse and doctor conversation, I'll give you total 9 scenes. Scene 1 is patient updates. Scene 2 is change in patient condition. And scene 3 is medication clarification. Scene 4, preparing for the surgery. Scene 5, emergency situation. Scene 7, preoperative checklist review. And scene 8, post-operative concern. And then scene 9 is about clarifying the post-op orders. So, and we have the bonus here, the vocabularies. And the section 6 is the conversation between nurse and nurse. Of course, when you work in a hospital, you need to talk to other nurses, right? As the team. So you have the scene 10, scene 11, scene 12, scene 13 for the conversation between nurses. And you will have ship handover, requesting assistance. Of course, you need to ask for help from your friends, from another nurse. So if you don't know how to ask for help, you just take a look for this. And scene 12 is discussing patient care plan. Scene 13 is cardiac arrest responses. So you have, in this scene, we have 3 nurses take action for the scene. And then we have the bonus for the vocabulary. Section 7 is a nurse and pharmacist. Of course, when you work, you need to talk to the pharmacist. You need to ask them about the medication, about doses, about the compatibility of the fluid, and with the medication when you mix it and you don't really sure that you can mix them all together. And you will have the missing medication, adverse drug reaction report, and then bonus for vocabulary. Section 8 is nurse and physiotherapist. So of course, because we work as team, and in your team is not only doctor or nurse or pharmacist, you will have another professionals, right, to work. So you have the nurse and the physiotherapist. You will have the scene 20 for post-operative mobility plan, and then fall prevention for the elderly patient, stroke rehabilitation, and burnout for recovery. And then section 9 will have nurse and nutritionist. Nutritionist will have the diet plan for diabetic patient and patient with the swallowing difficulties, food allergy concerns, and recovery, of course. And then the section 10 is nurse and lab technicians. So you have the urgent lab result requesting, you have the specimen collections clarification, and the missing lab report, okay? Section 11, we have nurse and patient assistant. Scene 29, requesting help with patient mobility, how you to ask them for help to lift up your patient, how to talk to them, how you communicate with them. I have it for you here. And of course, we have section 12 for the nurse and nurse supervisor. Of course, you need to talk to your manager, to a supervisor, for your head nurse. You need to have some conversation with them. I have some example for you, like reporting the staffing concerns or the performance feedback that your supervisor may talk to you. And then the section 13 will have the nurse and family members. That's, yes, of course, you need to talk to the family members, the mother, father, and son, and the parents of the patient, the sitter of the patient. So we'll have the scene like visits patient, taking a phone call from the family, and the family asking for patient update, explaining a procedure to the family, and family concerned about pain, okay? And section 14, I have the nurse and a patient. Of course, your patient, you need to talk to your patient, and we have too many kind of patients, too many specific disease that we have for the patient. So the conversation, the communication, the words, the terms, it may be different when we talk to the patient in cardiology concerns, or when we talk to the patient with the surgery concerns. So it's might different. So I have some of them, the example for you as well. So section 14.1 is nurse and new patient. We'll talk about admission, attending nurse, taking health history. And then we have section 14.2 is the nurse and pediatric nurse, pediatric patient. Section 14.3 is nurse and OB/GYN patient, and the nurse and dialysis patient, nurse and cardiology patient, nurse and surgical patient, nurse and orthopedic patient, nurse and gastrointestinal patient or GI, nurse and oncology patient, nurse and infectious patient, nurse and respiratory disease patient, nurse and eye disease patient, and nurse and ear disease patient, nurse and nose disease patient, nurse and throat disease patient, nurse and neurology patient, nurse and urology patient, nurse and allergic patient. When the patient has the allergic reaction, what we talk to them, what kind of communication that we have to use to talk to them. And then the nurse and emergency patient, nurse and critical care patients. Okay, we'll take a look inside. And this is the best step of learning English. They'll have you here for the step to learn English. And this is a little words to make you feel good, like English is the key to a world of opportunities. That's true. When you speak English, when you can speak English, the doors will open to you more and more. and you have a lot of chance to work wherever you want.